Hello, my name is Nathan Holt, and I'm a principal scientist and biostatistician at Juul Labs. I'm excited to present to you today our poster titled, Modeling the Population Health Impact of a Modified Risk Claim on an Existing ENDS Product. This study was funded by Juul Labs. The U.S. FDA Modified Risk Tobacco Product Application, or MRTPA process, provides a regulatory pathway by which modified risk or reduced exposure claims for a specific tobacco product can be communicated to consumers. Manufacturers can pursue one of two pathways as part of the MRTPA process, depending upon the type of claim. The G1 pathway for reduced disease risk claims must be supported by clinical or epidemiological studies. As you can imagine, pursuing a G1 claim would require long-term follow-up data that are currently unavailable for new tobacco products, including ENDS. The G2 pathway is provided for reduced exposure claims. That is, that using the product will substantially reduce exposure to constituents, reasonably likely to result in substantial and measurable reductions in morbidity and mortality. Central to the MRTPA process is providing evidence that communicating the claim would benefit the health of the population as a whole, taking into account both users and non-users of tobacco products. We used a computer simulation model to evaluate the G2 claim impact on population health. The simulation model we used is called an agent-based model, or ABM, and it models the tobacco use transition behavior and mortality experience of individual agents over time. An ABM may be used to model various scenarios, each determined by tobacco use transition rates and other parameters. Building upon the ABM of Wisman et al., we projected the impact on mortality from G2 reduced exposure messaging for Juul ENDS in the U.S. population. We modeled two scenarios, the base case and modified case. Both cases considered tobacco use transitions and agent mortality rates. The base case scenario included cigarettes and ENDS. Starting in 2018, agents transitioned annually between 9 tobacco use states over a 100-year follow-up period. A transition diagram is shown here. Base case transition rates were estimated using NHIS-CISNET, the PATH study, and a Juul Labs-funded longitudinal study of actual use behavior in adult Juul purchasers. The agent mortality model was developed using the Human Mortality Database and the NHIS linked mortality file. The excess relative risk, or ERR, of ENDS was set at 15%. The modified case scenario was identical to the base case scenario through 2023. Agent transition rates were adjusted in 2024 to reflect the effects of the reduced exposure claim. Transition rate modifiers were estimated on the basis of a 13,000 subject RCT assessing behavioral intentions with and without the claim, and an actual use study with nearly 18,000 subjects. Model outcomes included premature deaths averted, or PDA, and life years saved, or LYS. A net benefit to population health is projected when PDA and LYS are positive. The model is well calibrated. The left panel, figure A, shows NHIS estimated and model projected ENDS prevalence over the 2018 through 2021 period. The right panel, figure B, shows that by 2060, the model projected population is within 5% of U.S. Census projections. Marketing Juul products with reduced exposure messaging in the modified case is projected to avert tens of thousands of premature deaths and hundreds of thousands of years of potential life lost in comparison to the base case. A substantial population health benefit is observed under a wide range of plausible scenarios and sensitivity tests. In particular, a robust net benefit is projected with an ERR of 25% and with claim effects half as large as estimated from the large RCT and actual use study. In summary, marketing Juul products with reduced exposure messaging is projected to benefit the health of the population as a whole, taking into account users and non-users of tobacco products.